MedBix Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming. Welcome to the MedBix Webcast. This is a special meeting today. We have a guest, and I'm doing a little bit different today because I'm transmitting through Zoom. Usually the restream channels that I do is going to be a little bit different because we don't have that kind of a sounds and before. But we're going to talk about a little bit about. I'm going to introduce our guest. Because we're going to talk about wound care. Wound care is the biggest thing. Is billions of dollars are spent on wound care. And, they are using an element called boron. I'm going to explain to you about boron. I used to be a nuclear physicist. I was doing a nuclear engineering in University of Oklahoma in Norman, Oklahoma, where that I used to work under the nuclear reactor, educational small nuclear reactor. There were boron rods. So boron is a special element. That's the only rare element that absorbs the neutrons. It does a nuclear reaction actually. So, but in the wound care, it doesn't do the nuclear reaction, but it does something different. It is an amazing properties. We'll talk with the Vicki Fischenich from ETS Wound Care. Welcome, Vicki. I'm unmuted.
Thank you, Ramon. Thanks for having me on.
Yeah. Can you hear me?
Can you hear me? Yes, sir, I can.
Okay, tell me your background, Vicki. You got a strange last name and longer than my last name. So tell me your background a little bit.
My name is Vicki Fischenich. I am a geriatric nurse practitioner. Kind of been in the medical field since I was 18. So I started in X-ray and then went on to nursing school. So I did radiology for a very long time, MRI, CT, nuclear medicine, special procedures, and then nursing, and went into wound care and worked for Dr. Randall Walcott in Lubbock, Texas, who did a lot of biofilm-based disease. So he did wound care based on DNA analysis. So he's probably been doing it the longest for almost 20 years. He's been doing all cultures on a DNA analysis and treating the wounds specifically for what they grew. So
that is a big shift from radiology to wound care. What inspired you to go into the wound care?
Technically, it was actually all by mistake. I went into nursing school because we were doing all the cancer kids in radiology and MRI. And so we needed a nurse to do our conscious sedation for MRI. And so I said, well, you know what? I'm tired of waiting on a nurse. I'll just go to nursing school. So it was totally by mistake. I ended up in nursing school, but then Dr. Walcott recruited me for wound care, and I really did like it. I love it. I love wound care. I think it's one of the most, rewarding. You see a wound close that, save a limb. That's kind of rewarding work.
So what are what is this we spend on, I don't know how much does every doctor has some wound care system there, right? That patients go through diabetic ulcers. What are the wounds that you usually come across? What kind of wounds you're talking about usually?
Like wound care, just because of all our payers and commercial providers and Medicare, you kind of have to follow a standard of care type procedure and try to, nowadays it's based on cost-effective wound care to getting these wounds healed. So there's a lot of things you do offload if it's a diabetic foot ulcer, control their diabetes, which is generally very challenging. And it's the when you can start using advanced products. I think sometimes advanced products are wait too long to get started, and I think if we had an advanced product that could work much quicker and faster, I think we'd see really overall more cost savings for some of these payers. But they make you wait 4 weeks until the wound has deteriorated, or they make you wait. Even when dealing with pressure injuries, I couldn't get a patient on an offloading mattress until we could see, the bone. So it kind of seems like it defeating the purpose is waiting till the very end to start pulling out these advanced products to close them.
So
Sorry about the background noise.
Yeah, that's okay. The Zoom filters a lot of things out.
Okay.
I wanted to ask you that they used to use a placenta. Placenta they used to use in the wound care, but it's a kind of ethical situation. But is it this one is more effective? I know
Sorry.
you're moving too fast, too much.
Sorry.
Yeah. Is it this is your wound care they don't follow the traditional paths of wound care? You're doing such a very advanced new technology, new process that you're doing. Explain that a little bit more for us.
Well, there's a lot of advanced products out on the market right now. If you just even think about the placenta products that you mentioned, they're up to like over 150 placenta-based products at this point. And, now they're using placentas from horses. It's just like, it's gotten to be, I think now the advanced market has not done themselves justice by, I guess, becoming a supply now. When you have one or two, three unique things, you're a unique thing. But when you have 150 of the same placentas in every animal that has a placenta, you're gonna, it gets to be a little much, I guess. So some of the new types of products and synthetic skin substitutes, I think, have a lot to offer and deliver for this new next step. And I think this is why CMS currently is going through all these changes right now and trying to get a control of the spending, because a lot of these products haven't gone through and provided their efficacy and research. They just all kind of fell in like, well, this is my product is similar to this product, so let's get it covered. And so now I think CMS, by July of this year, there's going to be some significant changes to some of the payers for these advanced products.
So Vicki, placenta itself is generally good, but the companies that you're saying that a lot of people are coming with a different kind of products, maybe efficacy is there or not, we don't know yet. That's what you're saying, that right?
Yeah, it's going to be a little much, and I think if you saw the recent statement by the OIG that they just put out a statement about 4 days ago about these companies that have now, started to inflate their pricing, and it's getting out of control, and they're not, reporting their ASPs. And so I think CMS is going to make a lot of changes into these advanced products. And it's unfortunate because there's a lot of good advanced products, but, sometimes you fall into the same bucket, of abuse. And so how do you tell one from the other,
How is your company is it still they are safe from the CMS onslaught, or still you're okay? Your company is okay?
We are okay. We're a synthetic, so we are not any placenta or neonatal or cadaver skin. So our product just contains natural elements, and these are elements that the body has trace elements needs for, like calcium, magnesium, potassium, phosphorus, and boron. And even boron, people in this space in wound care find like, wow, I didn't know boron was a trace element, but boron is a trace element of the body. It has a lot with hormone regulation, anti-inflammatory process. It helps absorption of your vitamin D. and your magnesium. So I had no idea that boron was in so many
Yeah.
of the foods that we eat, and that we actually, if you supplement with that, like 1 milligram on some of the studies that I saw, it actually helps with osteopenia, helps you for postmenopausal women, possibly avoid that osteoporosis effect.
Yeah, it's a very boron is very highly present in the bones. That's so actually this is may not know, but they're trying to use a boron in the cancer treatment. In the cancer area, that boron, there's a nuclear reaction. They are using advantage of the nuclear reaction to treat the boron. They infuse the boron. In the boron is automatically goes to these cancer cells, and then if you put the boron and then put in the nuclear reaction, it absorbs the nuclear neutrons and then destroys the cancer cells. But there's a different issue. That is not a part. So tell me, how did the ETS wound care is special about ETS wound care? What you're doing, you're traveling around the country and you're pitching to the
Yeah.
doctors. And tell me about that. How is what you're pitching to the doctors?
Well, right now we've got a lot of things going. We're introducing our surgical line, and we hope to have our antimicrobial line, because you well know boron is. So when I go in and I meet with the physicians, right now we're running a large scale RCT in 12 sites. And so we're trying to recruit patients with diabetic foot ulcers that have failed to heal with standard of care. So we're actually sites in are in California. We have one in Casa Colina, Pomona, and then we have one starting up in Corpus Christi. We'll have one in Portland, one in Rapid City. We have a couple in Salem, Virginia. We have one in Homestead, Florida, not far from Miami, and
Atlanta?
yeah, we do not have one in Atlanta yet. It's coming, so that's one of our possible other sites. Will be starting in somewhere in Columbus, Georgia, possibly. Yeah.
So you're doing a clinical, these are clinical trials? Or
Yes,
you
sir.
doing, because still boron is evolving field, is the evolving system. It's so new, and the boron has a special signal pathways it creates a very fast recovery of, tell me advantages of boron patches, that boron, patch that you
Okay. Yeah.
do.
Well, the huge advantage, and honestly, Ramon, when I was introduced to this about 8 months ago into this company, and I've been in wound care a long time, it was completely new to me, this bioactive borate based glass product. I was like, I've never even heard of anything like that. But after 8 months of learning the product, spending a lot of time with my chief scientific officer, the value of this product, bioactive glass, its ability to be, he can, a seed can alter this formula and add it. Think about it, as I always say to the docs, think about it, a flour, and you can add whatever you want. You can either end up with chocolate cake or strawberry cake, but the product is bioabsorbable, biocompatible. You don't need to remove it. You can put it in undermining fistulas, tunnels, and it's absorbed by the body. You don't have to remove it. You don't have to worry about, with like certain wound care products, when you put it into tunnels and spaces, you worry about whether you left a piece in, and is a wound going to close up over this little piece that was left? So with boron, it's biocompatible, bioabsorbable, it's biodegradable. You don't have to worry about removing it. It goes into the body. It delivers all these natural elements of calcium. If you think about calcium, calcium is the first thing that pours out of your vessel when you cut yourself, and it pours out this calcium, and it starts this whole fibrin clotting, the whole initiation of healing. So in essence, I feel that when these natural elements are just providing what the wound needs for wound care. I mean, for the wound to heal. It's just elements that are missing in these long-term chronic wounds that have failed to heal, and now they're reacting to the elements that are in there.
So what is your company name? ETS Wound Care, right? ETS Wound Care?
Yeah, Engineered Tissue Solutions, and it's and most times, which Haraeus, I work for Haraeus, and Haraeus is the what you call the parent company of ETS, and they really plan on developing and expanding this bioactive glass into other uses because it's a great delivery system. Bioactive glass, you can deliver drugs with it, you can make spheres out of it, you can make sheets out of it, you can make fibers, you can select the fiber strand size, which they've selected a strand size that is exactly the fiber size of our own clotting clot, that natural clot that you would create on your own wound when you create a wound, break the vessel and calcium pours out, and then the spheres, and it creates a scaffold, and the tissue grows right into the meridian. So you'll see that from week to week. And acute wounds, wounds that have just had surgical debridement and maybe have a complication, those wounds are the ones that, I wish we could make that message out to the payers and get this out there, because one or two applications on these wounds that dehisce or go wrong right after surgery, our product reacts so quickly to them and closes them up without further complication and no use of IV or oral antibiotic. It's really quite amazing. The chronic wounds, of course, are going to take us a little longer, but if you've had a wound for 5 years and we're able to close it in 4 months, that's huge. That's a huge cost savings for payers and Medicare. But
particularly for the persistent wounds,
yeah,
is a very useful, right? That's what you're saying. That is very powerful.
And the patient will often say, and I think that a lot of it has to do with the boron. The patient usually expresses, "I have no pain, I have no odor, I actually, for the first time, I'm seeing progress." I mean, it really is such a different product that, I'm still 8 months. I get presented with wounds like, "Hey, do you think we can try this?" And I honestly, after 8 months of, telling people like, "Yeah, that one looks like it's a little far gone. It's 6 years old. I don't think we can help you." But then we get it done. And I'm like, okay. I had one that a lady from Mexico had her tibia exposed for 2.5 years. And it took us 3 applications and we were done. 3. I mean, I was like, that's almost insane to think, but you could see immediately with one application that anti-inflammatory process. Her leg was puffy and edematous, and in like 4 weeks, it was completely cleaned out. The leg had lost its, no pitting edema. It's anti-inflammatory, and I think that's why it works so well on pyoderma gangrenosum, because that's such an inflammatory wound that anything you do just sets it off. So putting Miragen on it seems to, in my opinion, from the ones I've seen, it must be having an effect on calming that inflammatory process that keeps those wounds spinning, and it works. It is amazingly works so well.
It is like a stem cell treatment for wounds, right?
And the fact that it's, it's been used, bioactive glass been used for 35 years in the orthopedic space, for building bone to bone. And so it's a product that's been out there forever that I thought, if it's been out there for 35, almost 40 years, like, why have we just now getting to
That's
it?
An amazing, yes.
Like, I'm like, what happened with science that we missed that one?
That is an absolute. I was exactly thinking same thing, Vicki. What is, particularly I'm a physician, I see boron all the time. We are boron, we are present everywhere. We missed a big thing in this one, It's right around us. It is almost stem cell kind of thing. Growth factor is amazing. Signal pathways is a boron is an amazing element. That's why I called it a wonder element. Yes. Thank you, Vicki. Thank you for joining with me.
You're welcome.
It is absolutely an honor. Tell me anything you want to do, final thoughts. What is the reimbursement? You want to say about reimbursement a little bit? and then we can
Oh,
close.
yeah, we do have our Medicare reimbursement is went live in July of last year. So we're in the high bucket reimbursement. Our code is A2002. And right now we have a lot of the MACs that are having successful billing for Medicare patients. So yeah, we're working on some commercials, but we've had good luck with our reimbursement. It comes in at 1,715. It's what the high bucket reimbursement is. But yeah, no, it works effectively, and it's a cost-effective product. And yeah,
Absolutely. So
yeah.
thank you for joining with me, Vicki. Thanks for taking time, right?
All right.
Settling between the airports. Thank you so
I
much.
know.
You know,
You're welcome.
thank you. Say hello
Appreciate
to
it.
your CEO, Christy Grogan. Right, Christine Grogan.
I will.
Thank
I
you.
will
Thank you,
let 'em
Vicki.
know.
Vicki Fischenich from ETS
You're
Zone Care.
welcome. Bye-bye.
Bye-bye.
Bye.
So, guys, that I'm going to do the presentation. I need to turn it off. This one, I didn't know how to. Yeah, let me. How do I take care? You know, just yeah, good. She is gone. But thanks for ETS One Care Company, and they need to. And then I hope one day their CEO will join with us, Christine Grogan. I spoke with her a few times. But I'm going to present now a very interesting topic. So before I present my new topic, it is a boron is a boundary element. It is present in the bones. There's a growth factor. The wound care is, it is not only, it is one of the fast becoming radiation treatment for cancers, because you take the boron is a only very rare element that absorbs it does the nuclear reaction. It absorbs the neutrons from the body. Very few neutrons from the body emits that neutrons from the nuclear side, and then it produces the alpha particles to kill that cancer. You know, the very strange thing about boron is that cancer tumors love boron. They accumulate, so you can give a high concentration of boron, you can give it to them, and then immediately that it all accumulates into the cancer cell, and then it emits the absorbs the neutrons, and then emits the alpha particles, immediately kills the tumor. Amazing. Is a science fiction. It is, you know, it's what Vicki was telling. It's been there for a long time around us, and we missed it. Somehow the scientific people missed it, the medical people missed it. Now it's coming back. It's ETS. That's a wound care. They don't do the nuclear reaction in the wound care. It does a special signal pathways, and it does the growth factors, all those things, and in fast becoming, differentiation and proliferation of the cell divisions, and all those things it does very good. It's almost like a stem cell therapy for wounds. I'm going to present a very similar topic. It is kind of a mind-boggling topic also for you. I'm going to present this. Let me just. This is a new thing for me. Just a minute. I don't do this usually in this one, just meeting chat. No, I'm not looking for meeting chat. Just to give me that 1 second, if you don't mind. Yeah, I don't do the Zoom. I have a special studio channel that I use. I'm doing this. Okay, this is going to be very interesting, guys. Bose-Einstein condensate. I'm going to share with you the screen. Slideshow. I think Jesus. Yeah, this is the big slideshow from beginning. Okay, that's good. Let me I will bring this Zoom, and this is ridiculous. This what the technology is sometimes. It is painful. Okay, I need to share the screen with you guys. Okay, I hope it works. Okay, this this is the this is the. Can you see it? I hope. Oh no, I need to. I hope I didn't. I hope. Let me share the sound. Just sorry, guys. This you got to put up with it. Yeah, share. But it's worth listening to. This is worth listening to the. I hope I don't know how it. Okay, it's working. Thank God, Jesus. This is really painful. But when they say technology is going to be just like magic, and then is eye candy. A lot of people don't know how to use Zoom, and there's so much. It's not intuitive. Technology is not that intuitive. It's a very, very complex. This is still people have to learn so many. I'm very good in technology. I have to learn 10 applications, 10 things. It's just overwhelming. Thanks for Vicki Fischenich from Vice President of Clinical Affairs from ETS Wound Care. She joined with us. She gave us an excellent thing that she gave us. So Bose-Einstein condensate is a gas. I'm going to explain to you what that is. A very peculiar. You all know about this is a fifth state of matter. Everybody knows some of the states. Plasma is where the sun is a plasma. All the stars are plasma materials because they have they don't have the structure like us. It is like the atoms and all those things. They have plasma, electrons and neutrons, and everything is like a soup. Electrons, neutrons, protons, they all get together. It became a soup, and it is all mixed together in the high energy system. That's what the plasmas do. This is not a blood plasma. What you're thinking about? This is a plasma from the state. The sun. Sun emits the plasma radiation, plasma state. It is in the plasma state. All the stars are. Then you know about gases. You know the oxygen, nitrogen, they're all gases. The liquid is a water, as you know, is highly present. And solids, we always work with the solid. This chair, this table, they're all chairs. And then the fifth state of matter, as strange as you think, it is named after Bose-Einstein condensate. The fifth state of matter, Bose-Einstein condensate. That is the state of matter. That is the Bose-Einstein condensate is a state of the matter. Okay, it is a peculiar state. It is very peculiar. I tell you why. When you take the water, I'm giving you very analog. They don't use the water in the sense, but the concept is same. If you use a steam, and then if you cool it, it becomes a water. And then if you cool the water, it becomes ice. If you cool all the way to the absolute zero temperature, minus 273 degrees Kelvin, close to that, something strange happens. Cool it all the way to the absolute temperature. The ice becomes something, the solid becomes a wave. Because it is a quantum principles work here. Heisenberg's uncertainty principle says, if you know any position, if a location and the speed are not mutually exclusive, they're together. They're not speed and the location are not mutually exclusive. What it means, either if you know the location, you will never know the exact amount of the speed. If you know the speed exactly, you never know the exact amount of the actual location. That is not the problem with the instrument or that your measurement problem. It is the nature itself is embedded in the nature. This problem is, it is a nature, it exhibits that property. Okay. So the Heisenberg's found out about it. That's why it's called Heisenberg's uncertainty principle. It's a fundamental principle of quantum physics. So when you cool it, what happens? All the atoms become zero. The zero speed, zero momentum. It is actually you can find out where the velocity almost became zero. So immediately you will know the location, right? But Heisenberg uncertainty principle restricts that, prohibits that. So that says that you cannot catch me and I become a wave. That is what it is. It is that's Heisenberg uncertainty principle exhibits a property here. So this, when you cool it all the way to the solid to the temperatures, it becomes a Bose-Einstein condensate. It is a light stopper. If you take if you put in the light goes through the light travels with 186,000 miles per second, 186,000 miles per second. But if it goes through the Bose-Einstein condensate, it almost comes to the grinding halt. It walks like a old man, okay, very slow. It is unbelievable. It is you can stop the tracks, put a grinding halt on the light itself, which is traveling 186,000 miles per second. You can bring it through Bose-Einstein condensate. You can bring it to the almost to the grinding halt. Okay, so it is a porous. If you put in the glass of water, it just drips off. It is a Bose-Einstein condensate so this is explained by a Irish fiction writer, Bob Shaw, explained this one very well in his book called The Light of Other Days. He passed away. But there is a slow glass story. If you are surrounded by, if you look at the truth through a glass, the Bose-Einstein made with the Bose-Einstein condensate state, slow glass. So you only see things that happened 10 years ago because it takes a long time to come other side in his story. So you see the reality is 10 years ago, but you don't know until you take that mineral out, it magically transforms into present day. Is that the guy is an old man, and in the picture is the wife and the child is there. And when you take the mineral out, he's old and wife is gone, and then children are somewhere, and then he's by himself. That is the story of the slow glass, magic glass of the magic Bose-Einstein condensate is explaining the Bose-Einstein condensate to slow glass. Bob Shaw is a great writer, a scientific writer from Ireland. So who is Bose-Einstein? What is the Bose-Einstein to do? Bose is Sachendra, his name is Sachendranath the Bose. Albert Einstein, already very well known. Sachendranath the Bose, when he was a younger guy, when still Einstein was living in Germany, he wrote a letter. Respected sir, I have ventured to serve you the accompanying, send you the accompanying article for your perusal and opinion. I'm anxious to know what you think of it. And he sent a special articles. I'm going to play a video. I'm going to play video. 1 second. I'm going to. That video will tell you a little bit about this. It's a little complicated to do all these things, guys, but bear with me. It's a very fascinating how that applies to the medicine. I'm going to explain to that. It's an absolute wonder. Then I'm going to this. What is that? What he proposed it? Just a minute. Okay. I'm going to go back to the Zoom. Oh, Jesus, this is painful. Okay. So share the screen. Yeah, I got it. Share this one.
In the 1920s, quantum theory was emerging as the best hope of understanding these strange phenomena. Its central idea was that atoms do not always behave like individual particles. Sometimes they merge together and behave like waves. They can also be particles and waves at the same time. Even for great minds like Albert Einstein, this strange paradox was hard to accept. In 1925, a young Indian physicist, Sachendra Bose, sent Einstein a paper he'd been unable to publish. Bose had attempted to apply the mathematics of how light particles behave to whole atoms. Einstein realized the importance of this concept and did some further calculations. He predicted that on reaching extremely low temperatures, just a hair above absolute zero, it might be possible to produce a new state of matter that followed quantum rules. It would not be a solid or liquid or gas. It was given a name almost as strange as its properties: a Bose-Einstein condensate. For the next 70 years, people could only dream about making such a condensate, which has never been seen in nature.
Matter can exist in various states. Atoms at high temperature always form gases. If you cool the gas, it becomes a liquid. If you cool the liquid, it becomes a solid. But under certain circumstances, if you cool atoms far enough to extremely low temperatures, they undergo a very strange transformation. They undergo an identity crisis. So let me show you what I mean by an identity crisis. When you go to low temperatures, the quantum mechanical properties of the atoms become important. These are very strange, very unfamiliar to us, but in fact, each one of these atoms starts to display wave-like properties. So instead of points like that, you have little wave packets like that moving around. It's really difficult for me to explain just why that is, but that's the way it is. Now, as you go to very low temperatures, the size of these packets gets longer and longer and longer. And then suddenly, if you get them cold enough, they start overlapping. And when they overlap, the system behaves not like individual particles, but particles which have lost their identity. They all think they're everywhere. This little wave packet over here can't tell whether it's this one or that one or that one or that one or that one or that. It's there and it's there and it's there. They're all in one great big quantum state. They're all overlapping. They're all doing the same thing. And what they're doing, to a good approximation, is they're simply sitting at rest. This Bose-Einstein condensate is very difficult to imagine or to visualize. I can imagine what it's like to be an atom running around gaily, freely, bouncing into things, sometimes going fast, sometimes going slow. But on the Bose condensate, I'm everywhere at once. I've lost my identity. I don't know who I am anymore. I'm at rest, and all the other atoms around at rest, but they're not other atoms around. We're all just one great big quantum system. There's nothing else like that in physics, and certainly not in human experience. So just to think about this causes me wonder and confusion.
Yes, you got that. So that's what is a Bose-Einstein condensate. Let me go back to so I will explain to you a little bit more about this, the condensate factor. Yeah. So that is yeah. So that is what you all saw that. I thought you already went through. Okay. That is the Bose-Einstein condensate. That is actually explained very well in that video you saw. Bose Sachendranath Bose was born in 1894 in India, a remote corner of India. So what is Bose-Einstein condensate? I want to go back to 1 second. It is omnipresent. It is almost like a godly material. Okay. Sachendranath Bose was born in 1894 in India. He was a physics professor. And these are luminaries of India. Even though they look like wearing a very Indian traditional clothes, this is a Jagadish Chandra Bose. He's one of the guy who almost invented Wi-Fi and semiconductors. The Megan Saha is another astronomer, a very famous astronomer. Prafulla Ray, Chandra Ray is another chemist, a famous chemist from India. They're all very, very famous luminaries of scientific luminaries. But after 75 years is gone, I tell you, so Sachendranath Bose was born in India. He was traveled around the country in the 1800s. In the beginning of 1900s, he traveled. He was with Niels Bohr. That's the left side photo. Both of them look cool. He was in Niels Bohr in Denmark, in Copenhagen. Then he was with the right hand side, Paul Dirac. He was meeting in Paul Dirac. Paul Dirac and then he was a short period of time. He was working with Madame Curie, Marie Curie, not Madame Curie, Madame Marie Curie. Don't get it wrong. So Bose-Einstein condensate, BEC, eventually it took 75 years. A lot of scientists thought it is a science fiction. You will not see anything more about that. So what they did was in the 2001, before that, Bose, three scientists, Eric Cornell, Wolfgang Ketterle, and Carl Wieman. Eric and Carl are from Stanford, but they moved to the University of Colorado, Denver, Colorado, and then Wolfgang Ketterle from Germany. They all get together in Denver, Colorado, University of Colorado, and they did this experiment. They actually brought the experimental verification. They produced the Bose-Einstein condensate after 75 years of death of the Bose himself, Sachindranath Bose, after 75 years. So it was the first realized in the University of Colorado with these three. They won the Nobel Prize in 2001 for their. So then thereafter, there are 10 Nobel Prizes for awarded anything related to the Bose-Einstein condensate. Think about that, gentlemen. So they did so this is the Bose-Einstein condensate, as you know, now they are, it is in the International Space Station. They did create a Bose-Einstein condensate because some of the medical things you can do, endothelium testing, endothelium cells, because of the gravity, they fall flat. But if you put in the Bose-Einstein condensate, they do three-dimensional structure. You can see clearly in the three-dimensional structure in the International Space Station. They did create, during the pandemic, actually, they did a Bose-Einstein condensate they created in the International Space Station. That's NASA's program, actually. NASA created that. Somebody saying that it is still is a very fiction, but somebody saying that if the alien ships are there would be probably Bose-Einstein condensate material. They're using it. They can appear and disappear. That's kind of a system there. That's what they're saying. That is still a long way to think of, but it's a good story to listen to. But Bose-Einstein condensate is such a magical material. So Bose-Einstein condensate has an extraordinary influence on the materials, on the cells. So any change in the atomic, the cells contain a lot of atoms, right? In the atoms, any change in the behavior of the atoms, any change in the cell, a small, minute change, it will affect the BEC. If you put next to within the BEC, means Bose-Einstein condensate material, if you put the cell, and if there's a small change in the cell itself, there is a big change you see in the BEC. So it's an ultra-sensitive sensor. So what it means, you can detect the diseases way, way, way in advance. 10, 20 years, 30 years before that, even that, because of the BEC reaction to the small, minute changes in the atomic level changes, it will catch up. This is a Bose-Einstein condensate. So disease detection, for example, for 1 in 10 women get breast cancer. So we need to find some solutions. You can figure it out in the beginning itself, 30, 40 years before, even a small area that is giving a problem, immediately you can surgically remove that. And then it's really a wonder Bose-Einstein condensate is a wonder detection, used as a new state-of-the-art ultra sensor in the future. In fact, they wanted to use in this one. They were doing a lot of research in the University of Buffalo. I'm going to play another video, very quick video. I know that I'm bothering you with the videos, but I have this is a little bit a strange way that I'm doing. It is a challenging, bear with me. Yeah, that is, so then I'm going to play this last video that I'm done. It tells you what kind of things they do. Just give me 1 second, guys. It is worth listening to Bose-Einstein condensate. I'm telling you, because it is really a fascinating story of people don't know about Bose-Einstein, you can listen this. Okay. So where is this Bose-Einstein condensate? I thought I opened it. Let me see. 4.2, maybe. Let me play this video. I think it is this one, I think. Let me play this video. I hope you can see it. But anyway, let me try my best.
You might have heard about a psychic squid that predicts a World Cup winner, or at least you have seen at the dinner table. The squid I'm talking about is neither. This squid accidentally fell on us 100 years ahead of its time. The squid contribution to the medical field is invaluable. It revolutionizes the way you predict and diagnose diseases. This squid hunts cancer cells like you've never seen before. It will pick up source of seizures in the brain like no other. It is just not picking the needle from a haystack. It can pick your lost nail from the Appalachian Mountains. Hello, my name is Ramana Anamaraju. I have a passion for physics, specializing in allied healthcare, and above all, concern for well-being of all humanity. Edward Flynn was hit by tragedy twice and lost both of his wives to breast cancer. When his first wife fell in coma, he used to visit her at the hospital. He used to whisper in her ears, wondering she may be understanding what he was saying. After a few months, she died. Not knowing his wife understood his undying love for her or not is frustrating. Then second wife, after a brief marriage, lost to breast cancer again. He is determined to do something about it. Edward Flynn is neither king nor can afford to build a Taj Mahal in memory of his beloved wives. But he built something better. He built SQUID. Acronym for SQUID is Superconducting Quantum Interference Device. As strange as that name is, this device
Stop. Just a minute, sir. This stupid technology, I hate it sometimes. Just a minute. Just a minute. I'm going to play this video in a second. Sorry that I did see that. You know, why it is not playing, I don't know. Bear with me. I'll try again. These stupid things, I hate it. Honestly, this technology, somebody has to solve this problem of intuitive understanding of technology. Okay. There's a lot of advantages and disadvantages, right, guys? That's what it is. You know, I don't know what I can do here. You know, just there is a bunch of idiotic stuff here. I don't even know where to do. Share, stop sharing. I told I just opened. Yeah. If I cannot do it, nothing much I can do. Let me try again. I'm tired of it, but bear with me. Where is this video? I can't see the video. Maybe that's here. Oh yeah, I see that now. I hope it works now. Okay, let me see. Okay, I'm doing my best.
That predicts a World Cup winner, or at least you have seen at the dinner table. The squid I'm talking about is neither. This squid accidentally fell on us 100 years ahead of its time. The squid contribution to the medical field is invaluable. It revolutionizes the way you predict and diagnose diseases. This squid hunts cancer cells like you've never seen before. It will pick up source of seizures in the brain like no other. It is just not picking the needle from a haystack. It can pick your lost nail from the Appalachian Mountains. Hello, my name is Ramana Anamaraju. I have a passion for physics, specializing in allied healthcare, and above all, concern for well-being of all humanity. Edward Flynn was hit by tragedy twice and lost both of his wives to breast cancer. When his first wife fell in coma, he used to visit her at the hospital. He used to whisper in her ears, wondering she may be understanding what he was saying. After a few months, she died. Not knowing his wife understood his undying love for her or not is frustrating. Then second wife, after a brief marriage, lost to breast cancer again. He is determined to do something about it. Edward Flynn is neither king nor can afford to build a Taj Mahal in memory of his beloved wives. But he built something better. He built SQUID. Acronym for SQUID is Superconducting Quantum Interference Device. As strange as that name is, this device is out of this world. He brought a mystical and elusive quantum nature of our universe to the benefit of the world of humanity. Edward Flynn is a nuclear physicist at the prestigious Los Alamos Defense Laboratories. He gave a remarkable gift from mother of all sciences, physics, to the field of medicine. A new machine, magnetoencephalograph, was born, usually referred as a MEG scanner. This exotic hair-blower-looking machine is a mag helmet made up of several squids, which are quantum devices that are designed by Edward Flynn's team. This machine, without touching the body, can read magnetic fields coming from a body that are 100 million times weaker than our Earth's magnetic field. Amanda Malmsberg of Wisconsin fell on the kitchen at the age of 8 with the first epileptic seizure. She was getting seizures almost 100 times a day by the age 16. With the help of neuroradiologist Dr. Deepak Raghavan, they made a journey deep into her brain by using MEG scanner.
MEG, or magnetoencephalography, is a relatively new tool that's become available to us, which is capable of looking at the magnetic fields generated by the brain and localizing them back on the anatomy of the brain. At this time, Fredericton Medical College of Wisconsin is the only center in Wisconsin which has a clinical MEG program. We do see patients from not only our hospital but other centers as well. Most people are familiar with electroencephalography, or what we call EEG, where you record brain activity or brain waves from electrodes that are planted on the scalp. Now, there is a substantial amount of tissue and fluid that separates the generators of that electrical activity in the brain and the locations at which we are recording this electrical activity, including tissues such as the skull and scalp. So that can substantially alter the view of what we are looking at in the brain, pretty much in the same way that if you're trying to listen to a conversation through a thick wall, you hear muffled sounds. You may vaguely be able to place people in different parts of the room, but not quite clearly see who spoke from where. So alternative techniques which are not affected by the tissue is of great interest.
Without single incision looking for the elusive source of epilepsy, it is just like looking for a needle in the Grand Canyon. It is that difficult. They found the source of her problem hiding deep inside of her brain. No other modality, including powerful MRI, even come close to these findings. The very tiny source of area that is causing her seizures was surgically removed, and Amanda is living happily ever after without even a single incident of seizure. The woman's life was given back by this remarkable machine. The researchers racing towards to find that very tiny number of cells that causing Alzheimer's, schizophrenia, depression, autism, and chronic alcoholism, and many other brain-related diseases. MEG scanner is taking on the most challenging and the deadliest disease of all for women, breast cancer. With the present technologies, you need 10 million cells to be affected before it shows up on any modality or device like a mammography or MRI. But the MEG scanner hunts for those few thousand cells causing cancer out of 90 trillion cells, not a billion, 90 trillion cells. Probably MEG scanner can detect breast cancer 5 to 10 years in advance before any modality. Vanderbilt Gastrointestinal Squid Technology GIST Laboratory is an interdisciplinary initiative by the Department of Surgery and by the Department of Physics to detect hard to find stomach ailments. Can go on. This is a direct demonstration of quantum physics in action through a medical device while saving countless lives. Nuclear physicist Edward Flynn may not have saved his wife's life, but saved countless lives on her memory and will be saving millions in the future. It is a better than a Taj Mahal indeed. Thank you for listening.
So what they're going to do is they wanted to use the Bose-Einstein condensate to shield the magnetic strength of the Earth's magnetic field. So it becomes a much more ultra sensitive, and then you can figure it out. You can detect the diseases way in advance. Not even a cellular level. You can further go down at the atomic level. It can detect the changes in the behavior of the cell. So I thank you for joining. Sorry about these technical difficulties, and I have to go through once in a while. I don't use Zoom. I use a different platform. So this particular company they work for the military, so defense. So they're all the technology is closely with us. So I have to do the Zoom only. They allow Zoom, but not anything else. Anyway, thank you for joining. It's totally wonderful. Tomorrow is going to be very good. Sunil Cherian from Blockchain Technology. He's an expert in blockchain, great friend. He explains very well. He's a great teacher also. So tomorrow we're going to talk about blockchain technology. I will go back to the normal platform. Thank you so much. Bye.